out to them, we have to take care of ourselves, so it's like the main thing. Lisa, can you just come up and then we'll talk and chat again. And yeah.
Hi everyone, I'm Lissa with Century Health Staffing. I'm not great at public speaking, but I'll do my best. Who here knows about travel nursing, or have you heard about travel nursing? Okay, great. We are a nurse-owned and operated agency located in California, but we staff nationwide. So a little bit about travel nursing. It is addictive. Once a nurse usually goes to travel, they usually stay. Not only is the money better, but you get away from the hospital politics. You go to work, you take care of your patients, and you go home. No staff meetings, you don't get called for your committees. I know when you work for usually private hospitals, you have to volunteer for so many activities, community activities or nonprofit stuff. So it's a way to kind of get back to just what most people get into nursing for, is to take care of patients. You get away from all the other stuff. And then you get to travel around the United States and see different places. So basically you're getting paid to vacation. You can work 3 days a week and make more than working as a staff nurse. It's not made for everybody, and it's a little hard to kind of get into it because it is a whole different world. When you guys go to work as a nurse right out of nursing school, you guys get, what is it, like a 6-month preceptorship where you have to work under somebody for 6 months. So you actually learn all the hospital policies and what's required. Well, as a travel nurse, you go in and you have maybe 3 days of orientation and you're expected to hit the ground running. So we like to see nurses transitioning to travel with no less than maybe 3 to 4 years experience. Because when you walk into a hospital, they're not gonna help you. They're not gonna show you where everything is. They're gonna expect you to know because you're considered the top nurse, the elite nurse. But it's definitely worth it because you do get paid quite well. And if you work more than 50 miles outside of your home, you get, part of your salary is tax-free. You never have to claim that with the federal government because you're subsidizing living more than 50 miles outside of home. So for instance, I have nurses working in California now that are working 3 days a week, and they're grossing $3,000 a week, taking home $2,600. So you're getting more what you're working for, and then you get the experience to travel all over. We have destination places like San Diego, San Francisco, Hawaii, Alaska, Florida, everywhere. So we do staff nationwide. Because we are a nurse-owned and operated agency, we are very involved in nurse advocacy. We participate in the Nurses Taking DC rally that's going to be going next month. We support anything that Show Me Your Stethoscope stands for. We are wanting to become more involved with the Silent No More campaign, which is the violence against healthcare professionals. So we're really trying to take a step in that and what we need to do to give healthcare professionals the support and stand up for what you guys need. We all know that healthcare professionals are kind of the silent heroes. You guys have to go in and take care of patients. You see things that I'm not a nurse. I couldn't go to work and see an abused child on life support. I couldn't go and see a gunshot victim. Those things would bother me. You guys have to see these things. You have to deal with these things. So you're kind of not respected, I think, in the profession that you're in. You guys are the front lines providing that patient care. You're taking the upset family members are yelling at you, the doctors are yelling at you, and all you're trying to do is provide patient care. So agencies like mine want to do what we can to stand up for you. And so I think the Nurses Take DC is an amazing rally. I'm not real familiar with New York, but do you guys have patient staffing ratios here? You're getting there, so that's part of it. California, where I'm from, is the first state that went to the patient staffing ratios. So it has really made a huge difference in California. So we get a lot of the nurses that come from the southern states, from the northeast states, they come there. Your med surg nurses aren't seeing more than 4 or 5 patients, having 4 or 5 patients, which we know some states, you guys are seeing 10, 12 patients. How can you give quality patient care when you're dealing with 12 patients? You're dealing with family members, you're having to stay at the nurse's station and chart like crazy. I cannot believe what you guys have to chart nowadays. I mean, it's off the wall. So how can you provide that? That's what we try to do. We try to guide you guys through the best way and try to put you in staffing positions where you're not going to fail. We want to make sure that you succeed. So we do travel, we do permanent placement, and we do for all healthcare. So we can, as long as you're a healthcare professional, we can place you in jobs anywhere in the United States, permanent or temporary. Traveling, we get people from young nurses with a couple years experience, want to go out and see the world before they settle down and start their family and buy a home and do all that. We have empty nesters, people that their kids have all went to college and then they want to get in an RV and travel across the United States and see different states and meet different people and work in different aspects. We have recently divorced people that have always been home and worked at one hospital for 20 years and now they're single and they want to get out there and explore and live life. So there's such a round arena for everybody can get in there and do that. And I have to share something that is probably one of my most proud moments in being in this industry. I had a couple come out from Florida, a young married couple. They were in their mid-20s. I don't know if you guys know much about Florida, but they don't make anything for money. And their staffing ratios are, they don't have any. A med surg nurse got 16 to 18 patients. Their acuities are just through the roof. They went out to Las Vegas on their first travel assignment. The agency that they were with, now mind you, they're a young married couple, only been married a year. She was med surg nurse, oncology, he was ER. Packed up their 2 dogs, their 2 vehicles, gave up their house, drove to Las Vegas, and there was no assignment for them. Never really been away from home. So they got my name through one of their friends. I brought him to California the next week, got him a California license, and this was 6 years ago. Been working for me ever since. They were able to pay off both of their student loans for nursing school. They were able to save enough money to go to nurse practitioner school and pay cash. So 6 years later, working as nurse practitioners in California. They would never have been able to do that if they hadn't jumped into the travel nurse arena. Again, because half their income was only taxed and they were making a lot more money. They were working part-time as a traveler and then going to school. So now they are family nurse practitioners, gonna go back to their hometown of Florida and buy a home and practice there. So there's just so many success stories in this. Again, it's not for everybody, but once you get the taste of it, you kind of get addicted. I love it because I get to meet so many different people from so many different areas and get to do what I can to help. But, does anybody have any questions? Yes.
How, in terms of working in different states, how do you go about helping nurses obtain their license?
Well, there's a lot of the states are going to start to go compact. I don't know if you're familiar with what a compact license is.
New York is not one.
New York is not one of them. California probably never will be because they like their money. Florida just recently went to compact. So that's another initiative that they're really trying to work on to make it standard across the board. I don't know if anybody knows what compact nursing is, but what it is if you're in a home state that is a compact nurse state, you can go to work in any other state without applying for an individual state license. Recently, when we had the hurricanes, Florida hadn't converted to a compact state yet, so what they did is the governor said that anybody outside could come in and work as a nurse. So they're starting to see how that really benefits the different states to do that, so we're starting to see more states go to there. Some of them will never do that. But what we do is if you don't have a compact nurse license and you do want to go to work in a state that doesn't, we give you all the information on how to apply, what you need to do, and we get you going. We are physically in California. California takes the longest. They can take up to 6 months to get a license. What we have found is if we personally hand deliver the application, actually somebody receives it and they can expedite it, so we do that. So if nurses do want to get a California license, I would work with them, get you everything you need. You can send it to me and I will hand deliver it, and then you can usually get a license within a month if all your education meets their requirements and your live scans and all that stuff. So just depending if you have everything you need, we're seeing people get them within a month. So we do assist with that. We've even flown nurses out to Sacramento where it's at, go in there, do what you need to do, and then when they get their license, they come to work for us. So we're a little bit different than other agencies. They'll make you sign something to say that you have to work for us, but we're not like that. We just want to help the nurses in every way possible. Also, I'm very active on social media with advocacy, so even travel nurses that don't work for me will actually reach out to me to ask about their assignments, is their agency being honest with them, what should their agency do, those types of things. So I do guide everybody without asking them to come to work for me, because again, we're more active with the advocacy side. Any other questions? Yes.
Does your agency require nurses to sign contracts?
Contracts are usually 13 weeks. So what it is we will place you, and we only staff acute care facilities. So we don't do home health, we don't do clinics, those types of things. We do the Department of Corrections in California, but other than that, it's all acute care facilities. You will sign a contract, which depending on what the hospital requires and what you're signing on for, standard is 13 weeks. We have some that are 8, we have some that are 6 months. So it just depends. And you just guarantee that you're gonna work for us for those 13 weeks, and you are our employee, you're never the hospital's employee. Okay. Yes,
I'm a labor and delivery nurse, so it's one of those rare species, right?
yes.
So let's say I would go to another state. I don't want to be dealing with, like, because you're a guy, blah, blah, blah. I'm in New York City, so I'm sure that here was the problem. But what is your expertise when it comes to that? Because that's one of the things that has been deterring me from doing it. I don't want to go to Indiana and then they say, no, you can work here.
Right.
Because I'm a guy. So what is your expertise in that?
You know, I'm gonna be real honest with you, I've probably have only had a handful of male L&D nurses in the whole time that I've been doing this. Usually that's not an issue. I've never had that as an issue. If you're qualified, your credentials are sufficient, you have the experience, we're seeing a lot of, are you A1 certified and all of that?
Fine.
None of that. Usually, as long as you have the credentials, because there's always such a shortage with L&D nurses. Any other questions?
I know it's mostly travel nurses, positions that you do, but then before that you said you do permanent.
We do permanent placements also, yes,
So that's in California only?
nationwide. We contract with so many facilities nationwide, and some of them will have permanent placement opportunities. I don't have it in every state, but if I don't, all I have to do is pick up the phone. So if you were to come to me and say, I want to go to work in this state, I could definitely, find something for you. Yes.
So as permanent placement, is the nurse an employee, is your employee, or
No.
then becomes an employee of the hospital?
No, what we do is we have hospitals, facilities reaching out to us because they're unable to recruit, so they'll come to us for permanent placements. And what we do is we pre-screen, make sure that you meet all the requirements, you have all the required credentials, and then we submit you to the hospital, you interview through them. So basically, we're just kind of a pre-screen for them. So you will go to work, as permanent placement, you go to work for them. And we do also per diem, or there's several words for it, per diem, registry, day-to-day staffing, and that's just where, I have a lot of nurses that do that. I have a lot of per diem in California, so they'll work staff at a hospital, but they'll come and work for me per diem at another hospital, just to kind of get that experience of working in a different atmosphere. I have a lot of, I'm in Bakersfield, which is Central California, so we have a lot of the smaller hospitals. I'll have nurses work for me per diem in Fresno, which is a university, which is a training hospital. Their ER, they think they have 40 nurses per shift versus working in a hospital where you've got 10 nurses per shift. So a lot of people like to change it up and just do that per diem. You're not obligated. You can work as much as you want, as little as you want, which is different than the contract nurses, because you have to contract and work for 3 days for 13 weeks. With per diem nursing, you just work whenever you feel like it. So that's always an option too. If you have any local agencies here in New York, it's a good way to kind of get more experience, try out some different facilities, see if there's some other things that you like. That's always my suggestion. If you want to kind of start going towards travel, I would do a per diem first. Okay, any more questions? Okay, great. I have lots of pens back there. Take them, please, because I don't want to have to carry them back to California. I have brochures and business cards back there. Even if you don't want to work as a traveler, if you just want to get some information, I'm always accessible. You can text me. My cell phone is on there. Email me. Anything. I'm always willing to help nurses any way that I can. Okay, great. Thank you.
All right, so I'm stepping in.